a high time I will also move from OneNote to Notability.
Live.
Hi everyone, hello Dr. Rajat, and good evening to all of my students who have joined me live.
Good evening, everyone. I hope we are audible. Can you please give us a quick thumbs up to check whether the audio and video is fine? Good evening, Dr. Praveen.
Hi Dr. Rajat, and yes, good evening to everyone. We are just checking now, guys, if the audio and video is fine or not.
So, Dr. Praveen, आज क्या लेकर आए हो students के लिए? We are audible. Can you please give?
Hi sir. So it's not a something new that we keep on doing on a day-to-day basis. This time we need to talk about how the revision should go upon 3 months, around 3 months remaining. The countdown as such has started. So we need to understand the time, its importance, how to make our preparation better and better on each and every passing day, and what we can do to improve our scores of grant test and eventually getting a better rank in NEET PG.
Yeah. So, guys, always remember that a structured schedule is something that is going to give you a rank. Obviously, everybody will have a different level of preparation at this stage. Now, before we give you this schedule, I want to give a disclaimer that if you are following a schedule till now, please keep on following it. However, if you think that your preparation has lost a track and you do not know where are you standing right now, then it's a good idea to go and follow this particular along with a provision to know the schedule is gonna be there. And I would request everyone that please put your queries into the comment section so that we can address them. Over to Dr. Praveen.
So hi guys, in this entire schedule, we're talking about few important things, and one of them would be a day-to-day schedule. How to plan your grant tests. So first of all, we'll talk about grant tests in a later part of the entire discussion. Let's talk about, first of all, what and how can we move forward to improve our rank. So as far as revision is concerned, we have first divided how many days we need to put forward for each and every subject. For the first year, an at 3 days is sufficiently enough. For revision purpose, physiology 2 days and biochemistry 3 days. Second year mein path pharma and should be given 3 and 3 days. Micro can be done in 2 days and forensic medicine can be done in 1 day, a revision purpose. In the third year, I and ENT, both of them would be requiring around 2 days and PSM should require around 3 days. And for final year, the longer subjects, medicine, surgery, gynae should take at least 4 days. Pediatrics should take only 2 days and 1 day for eventually all 5 subjects. So there's a basic addition of the plan, and if you just keep on adding to these all, we need to just finish the entire first reading by around 31st of January 2024. Now, before I move forward, I would again request Dr. Rajat to put his thoughts over this time discussion as to how should a student improvise and change his thought process on this time provision, first year, second year, third year, fourth year.
No, I think it's a very balanced timetable, Dr. Praveen. But I always believe that one size does not fit all. So this is a standard timetable for the student. You look at this timetable according to you, and you feel that if you think that you have read a subject pretty well, you can decrease the number of days for that. But if you think that no, this subject you have not read it, then probably you can follow the same. So all these schedules are broadly a guidance schedule. Ultimately, the aim is that it's you. It has to be individualized as per your understanding of the subject. Now, let us say that there is n number of days given to a particular subject, and you feel that it is less according to you. You can add one, but then you have to subtract one from another subject. The net result is the total revision should be finished by 31st January 2024. And that is the entire idea that I have. Over to Dr. Praveen.
So guys, when you talk about the day-to-day schedule and a cumulative schedule, we need to focus on few important things, that what are the main topics, and individually we should divide the entire topic into some important days there. Now, this PDF that we have prepared is based on a thought process that the number of days you would be taking is as per my previous discussion. That is 2 days for physiology, 2 days for biochemistry, and 3 days for 3 days for biochemistry and 3 days for anatomy. So, what we have tried to do here is we have to pick out the individual topics that are very important based on the discussion, based on the PYQs and the PYTs, and put forward in the eventually time frame. How much time frame should you complete into it? For example, on 11th of December, starting from yesterday, this was also told to most of the groups and those who are our students right now. So, if you haven't started from yesterday, that's 11th and 12th, you can start from tomorrow. That is straight away pathology. So from 13th of December, we are starting from pathology, and the most important topics you can catch up from here, like the first up to 11 a.m. You must be able to complete general pathology, में cell injury, cell death, inflammation, a quick revision. Okay. In general pathology, bleeding, coagulation, and immune system and hypersensitivity reactions with amyloidosis and graft reduction should be done up to 3 p.m. And then you should take about the cancer, neoplasia topic till 7 p.m. On 14th of December, we're picking a grand test just to evaluate where you stand forward. And then on 15th of December, we should start with hemat. Now, every topic has to be completed in this amount of time if you're following our schedule. If you have your own schedule, and you are more than better you follow your own schedule. But if you haven't followed a schedule as of yet, this is a very good way to move forward. Moving to the other days, like again from 11 a.m. forward, you must now try to complete the cardiovascular system till 3 p.m., respiratory system till 7 p.m. And what to do post 7 p.m., we'll talk about that separately. Okay. On 2nd December, you must just cover GI, endocrine, and skin, and genetics, and liver, renal system. So these all the system you can complete in 3 days if you have read the previous reading in a better way, or just to have at least gone through the previous readings. In this way, the entire PDF has been prepared, comprising of pharmacology. Then we move across and move into the general medicine, 4 days for general medicine. All of these important topics have been prepared, and all these will be available in our Telegram groups individually, as well as in the Auto Telegram group also. Then moving across, pediatrics should be done in 2 days. And so 25th of December and 26th of December, you must be able to complete pediatrics. I'm just scrolling through just to tell you how we have prepared this. And psychiatry should be done in the single day, that is 27th of December. Next grand test comes on 20th of December. Anatomy then come across, and post anatomy we will go into general surgery. So we are just trying to also include that post anatomy you must be able to complete surgery, post medicine you must go through, so post pathology you must go to pharma, and then post path and pharma you must then complete medicine. That's a very good way of revising the entire thing in less amount of time. Moving across, you will just see that we are starting from January right now. And orthopedics on this first single day, that's 6th of January, we can complete orthopedics. Rand test next comes on 7th of January. OBG comes from 8th of January. And different topics have been again incorporated to cover everything that is important for the NEET PG point of view. Then ENT on 12th of January. As I told you, 2 days for ENT is really sufficiently enough. Ophthalmology from 14th of January. Again, 2 days are sufficiently enough for ophthalmology. And there is biochemistry here. Then there is microbiology on 20th of January, including that too on 21st of January. Post that, dermatology on a single day. And finally, we move to radiology on 24th of January. Next grand test, we are trying to move into 25th of January 2024. SPM on just 3 days, 26th, 27th, and 28th of January to SPM. And forensic medicine on 29th of January. Post this, anesthesia is on 30th of January. And the final grand test we are moving into is 18th of February 2024 for the first planning. Now, just to come back to what we must do also here, I'll talk about a very important proposal that was discussed this time. And there is something called as catch-up day this time, catch-up day. So, what are we planning in catch-up day? You will see that in the entire PDF we have prepared, we've tried to put after every three subjects one catch-up day. So, what's a catch-up day? Catch-up day means you have to complete you all have appeared for various tests, you have appeared for various Q&A test series, you have appeared for Q banks, and you also prepared a 20th notebook. So, when is the time to read that? The best time to read that is on catch-up day. So if you scroll the entire PDF right from the beginning, you'll see a lot of catch-up days in between. For example, I'll show you this on 24th of December, we'll put a catch-up day. So what we expect you to do on these days is try to revise your cumulative test series that you appeared for the previous time. Try to go through the PYQs if you have left out and you're not able to revise, because these are already packed days in this time. And the question bank bookmarked that you have been always wanting to revise it, this is the right time to revise on the catch-up days, including the 20th notebook also. As much as possible, you must try to do that. So I would now invite Dr. Rajat also to comment upon what are the things that you must talk about and focus when revising a subject, not rereading. It's a revising. So what's and how should we revise for a better rank?
The rule is very simple. The revision should be done on the things that you have already visited, and it's revisit. And always look at this. I'll give you a very simple example that I have given a lot of time in my class. If I keep on revising, my name is Rajat, my name is Rajat, my name is Rajat, it is not going to add more to my knowledge because I already know my name is Rajat. But if I am forgetting something and I'm going to revise it, it's going to add more to my knowledge. Now, what does that mean? Whenever you are reading and you think that there are things which are forgettable, those are the one that has to be revised. Now, what are the things that are forgettable? The things which are more factual are more forgettable. The things when there are tables, these are more forgettable. The things which you feel are gonna be more high yielding for you, those are the one that has to be revised. All right. So now always look at this particular part. Like let's take an example, the one that is in front of me, inflammatory bowel disease. Now let something is right over there. Now what you should think about that inflammatory bowel disease. Do you fundamentally know the differences between Crohn's disease and ulcerative colitis? Do you know that which one has skip lesion, which one does not have a skip lesion? Do you know that which one has cobblestone pattern, which one does not have a cobblestone pattern? So this is how you have to very, very quickly do and identify. Always remember that revision has a rule, and that rule is ideally you should not add too much. You should not think about that you have to add this, you have to add that. And the preparation has a very, very simple aspect. There is no limit onto the number of or the amount of content that you can read. But do this promise to yourself that if you have read something and that is asked in the exam, you're gonna make sure that you will do it correct in the paper. If something is asked from a topic that you have not covered, don't bother about it. So one thing that you have to do is you have to remove this word FOMO from your mind and ignore this word fear of missing out. And as Dr. Ashwani has said once, that don't bother about FOMO. Think of JOLO, joy of leaving out. Yeah, JOMO, joy of missing out. Ignore it. But whatever that you have covered, you have to make sure that you are reading it well and you are able to do it well in the paper. Do this promise to yourself. If a question is asked from a topic that you have covered, you will make sure that you will do it correct. If it is asked from a topic that you have not covered, you are not bothered about it. I am telling you, your preparation will be far, far better and you will be able to get to the highest of your potential that you're looking for. We have tried to create the best possible utilization of the time for you. If you're gonna move it here and there, if you're gonna keep on thinking कि चलो यार एक कुछ कैप्सूल कर लेते हैं, ये कर लेते हैं, कुछ नहीं होने वाला. I am telling you, focus studies, focus on all 19 subjects in a dedicated environment, and that is something that will be giving you the rank. That's all from my side. Over to Dr. Praveen.
Thanks, sir. I'll just take a few queries before I move to the grand test and how should you appear for that. And one of them is, sir, the PDF is available right in our Telegram group. After the session, we'll share it there. Sir, for me, I'm a slow reader and it takes more time for me to complete. That is very well okay. Because some of us are slow readers, some of them can quickly read it. But eventually, what is important is how much you retain from the same reading. If you're able to retain that from a good amount of first one reading only, that's really good enough, and that's sufficient for you. But if you feel that one reading is not sufficient for you, you read fast, but if also means the same topic must be revised by you multiple occasions. And that is what I'm telling you. Try to use your 7 p.m. That's suppose we are ending our entire reading from 7 till 7 p.m. Till 7 p.m. till 8 p.m. you have your own timeout. And then from 8 to 10 p.m. you should revise every topic which you might have read in the previous days. So eventually, example में समझो कि suppose you are reading endocrinology right now, and in the endocrinology, some hyperparathyroidism is very confusing to write you. That is the differentiation of the calcium levels in different types of hyperparathyroidism. So if this is confusing to you, you have a table in your notes. What you must do is try to read that table multiple occasions. But reading it once and then reading after 1 month will not land you anywhere safer. So try to annotate the notes in a better possible way. Try to bookmark this. You can put some flags in your notes and try to revise that page on multiple occasions, going from here onwards till the NEET PG. And that should be not less than 3 to 4 times, that particular page. Shushmita asking, please comment on eGurukul roadmap schedule. Is it planned according to these points? Yes, more or less, they both all are same, have the same concept behind it.
And one more point, Dr. Praveen, that I wanted to re-emphasize. If you are following any other schedule, for that matter, if you are a auto student who has not yet completed your revision and you are already finishing it by 31st of December, keep following the same schedule. And we're gonna add one more schedule to your preparation. Don't bother about it. Okay. Now this is specifically for those students who have either completed their revision and starting a new cycle of revision, or who have completely lost track and they do not know what to do. So it is only for those students. Anybody who is following any other schedule should not change their schedule and should go with this particular part. All right, over to you.
So two things before I use take over to me. One is how to include vibe in the entire reading. That's point number one. About the grant test, we'll talk about this later on. How to include vibe or any image session in this reading, right?
Yeah. So see 2 points in this. The first is that we have put up catch-up days. All right. So the whole idea of putting up this is so that you can accommodate the vibe also. If you want to accommodate vibe, you just remove the catch-up days and put those catch-up days into the session that we have covered one. The second is, if you don't want to do that, you want to follow it because you feel that changing it is going to break your rhythm, then do the vibe as per subjects. That whichever subject that you are doing, cover that part of the component of the vibe with that one. Second, don't worry about that. You will be finishing in the 31st of January, and then you can complete or the cover the vibe after the January in the first part of your second revision. That is another thing that can be done. So there are multiple ways to accommodate this. It can be covered on the catch-up days. It can be done with along with each subject. Radiology will be done with radiology. Pathology will be done with the pathology, and so on. Or it can be done from first week of February. That is another way to put it or to add it into this.
Okay, sir. A second thing that's about a few questions are here is question bank compulsory or not, and mentioning one of the Q bank. The question bank is really important, and how you use it, it all depends upon how smart you are. A smart student getting a very good rank would always try to use a custom module of the Q bank. How to use that? You have to know that what are the most important PYQs in a topic, in a subject as such, and try to solve the question based on that PYQ topics. So once you've read the PYQ, you're not getting anything new about it. You have read the PYQs, you know the answer, you have read the explanation on one side, that's completely enough. Ho gaya, khatam. The next time you go about the PYQs, either you get something new from the explanation, that's one way, or whatever question you have solved till now from the question bank you have done, try to also read and revise that answer of the question of that bookmark questions in the catch-up days. So right now, solving new question from the Q bank, I don't think that is really possible. Maybe you can try it, but personally, I don't feel that's actually possible. But
yes. So ideally, I believe that if the question, somebody is talking about the question bank, it should have been done by now. If you have not done it by now, you do not have a time to do it. It's as simple as that. Those who are saying that whether they should do question bank, it should have been done from the NEET, last NEET happened in March. So from April to now. But if you could not do this, then this is not the time. The only time is revise your notes, do the PYQs, and do the GT. That's all. There is no fourth thing that you can do at this stage.
True. And a few other questions like how to manage preparation with job. What you can do is, and it's done by university by everyone. I should not say this on a social media channel, but for the last month, you must take a month off. That's one thing you must talk to your colleagues. If you're really preparing and your colleagues are supportive, take the month off. You can take a no pay salary and then continue over the same thing.
Then who will work? If everybody will take a no pay salary, then who will work?
I think something should be more important right now, and that is your NEET PG, and then everything else comes. Now coming to the grant test, sir. Now this is a very important point, and everyone is really concerned about what we can do for a grant test. I think to see, Rajat sir told once, to improve on a grant test, what you must do first of all is give a grant test. That is what is a very strange statement, and I want sir to tell about what does this statement mean.
No, that statement means that, see, people do not write the grand test. I do not understand what is the reason behind it. Why people are so afraid of getting themselves tested? Why you are not ready to see that mirror? I do not understand that. And why do you, okay, I do understand this, that if somebody will come to know about your score and somebody will say that, oh, you have got a bad score, you might feel bad. But why you are telling it to anybody else? Don't tell it to anybody else. Just see it for you. Just identify yourself that where are you going wrong in this, because till the time you do not know where are you going wrong, how will you improve on that? All right, so the first thing is that write a grand test in an examination atmosphere. Write the grand test in a way as you will be writing your main test. Do you know, analyzing the grand test is much more secondary. The primary aspect is to write the test in the examination atmosphere, because if you get an idea of feeling the same stress, I am telling you, it will automatically improve you by 10 to 15 questions. If you do not get anxious, if you know how to manage the time in 3.5 hours, I'm telling you that is itself more than sufficient to get an added advantage of 10 to 15 questions. Imagine, analysis is a much more secondary aspect. The primary aspect is write multiple grand tests in an examination atmosphere.
True. And about how should you write a grand test? First of all, there's a schedule here, and you may follow this schedule or whatever schedule you're following. But the plan is to write every one grand test every 15 days in the month of December and January. One grand test every 10 days in the month of February, up till at least 20th of February. And the last 10 to 15 days, I don't think we should appear for any grand test, because that can just make us more and more consciously a bit tensed. About when should you review a grant test? The best way to review a grant test, best time to review a grant test is the day on giving grant test. But if the PDF is not available as a solution to you, you can review on the next day whenever the PDF is available. I don't think it is a good idea to spread out the entire revision of the grant test, review of the grant test in the days of the subject reading of that subject. It's better you complete the review of the grant test on a single day, take out time for that. And about how much time should you take to review a grant test? I think this is also is a very different statement. Some of the toppers often say that they took around 4 to 6 hours to review a grant test. But one should understand the toppers did only 60 mistakes. So they eventually got 140 correct. So if your score in the grant test is around 90 to 100, the amount of time you will take a review grant test should not be 4 to 6 hours. It should be at least 8 to 10 hours. So you cannot have the same reading for everyone. You should follow what toppers are saying, but you should also analyze your brain into how much time you should look into that. A lot of questions have come up, sir, in the...
Yeah. So I will take up a question Karthik has asked. Karthike has asked, in grant test, how to decide which question to be kept for second phase. Yeah. So my idea about this is that how I used to do this is I'm gonna attempt very quickly the entire paper, and in the first attempt I'm gonna mark all those answers where I'm 100% sure. It will give me an idea that how many answers I am damn sure is gonna be correct. In the second reading, I'm gonna answer those questions in which I had a 50% chances. And in the third attempt, I'm gonna mark all the answers, because I believe you should not read any question or you should not leave any question in the grand test. You can skip the third step and you can go with the first two steps. But that is how I'm gonna attempt it.
Actually, that's a very good way, because you also need to analyze the time management in the grant test, because the same time management you'll do in the main exam. And that is why the first statement Dr. Rajat told was to give a grant test in the exam environment. Okay, but every question should mean that this question may actually come in your NEET PG exam, and don't take grant test lightly. Whatever the type of question is, because grant tests are prepared by a set of students in every app who actually have themselves got a very good rank, and is often seen by some of the faculties too. So what you must do is try to first of all mark those questions you know, and then leave out those questions which are very lengthy or you don't have no idea. Then come up again back to those questions which you have left out or marked for review, or you have just guessed it, and try to change the answers, and then see changing the answer, does it make it correct or you make it more wrong. The number of attempts you should give in a grand test should not be less than 180. It should be more than 180, 185, around like that. And see that when you mark a grand test, question completely based on your gut feeling, does it really make it right, or eventually it actually gets wrong? So that is one thing you must also focus upon.
Yeah. And Pradyuman, but your vibe session will be very, very useful. I'm not telling anybody to skip the vibe session. Over a period of time, our experience has been that the vibe has definitely added extra marks in students' preparation. So this is definitely going to be useful for you. We have already told you the ways to accommodate vibe into the system. All right. So there is no doubt about it that vibe is going to be very, very useful session for everyone. Ashish has asked.
Oh, yeah.
Okay, go ahead.
Sometimes we change the answer and that question goes wrong. I think this is the question that you were all about to take, but that's completely fine. You must also see at the positive side of it that how much question actually gets correct when you change the answer.
People don't realize that. The problem is that if you change your answer and your answer gets correct, you never realize that you actually changed the answer and it got correct. The only problem that happens is when you change your answer and it gets wrong. Obviously, if you are changing an answer, that means you had a confusion. And whenever you had a confusion, your answer cannot be 100% accurate. So you're bound to have some wrong in those also. I mean, that's a part and parcel of the game.
And how should you open the notes for every question going wrong? No, I don't know whether it's possible or not. Doing a lot of extra things will, I don't know, just don't make it complicated, just make your preparation simple. Simple in the way that if you're reviewing a grand test, you look at the explanation, something new comes up there, you bookmark it or try to put in the 20th notebook and get over with it. On the next day, start with the next subject. On the day before the grand test, at least read the 20th notebook you have been preparing and making for the last so many days. That's it.
Yeah. Yes, Ashish, that can be done. All right, guys. So that's all. Dr. Praveen, is there anything else that you want to add?
I think we have tried to accommodate a lot of questions today, and maybe if students would require, we would again come live in upcoming days, and just try to prepare, guys. Start from the day one. Tomorrow, if you are preparing with our schedule, it's pathology. If you're preparing your own schedule, just give the number of days we have talked about in the beginning of the session and just prepare according to whatever you feel comfortable. But just don't feel demotivated this time. Everyone in the same boat feels the same, that they're forgetting a lot, they're not getting enough score in grand tests. And eventually, whoever keeps on preparing the last day gets a very good rank. And those who stop in between, thinking about they cannot make it, then ultimately have to prepare again the next year. So it's you who must decide where you actually land into.
Guys, we are always available for everyone. Do let us know that if we can do anything for you. But please remember, at the end, it is you who has to write the exam. It is you who has to work hard. And I'm telling you, please focus for the 3 months. You can really remarkably change your preparation. I'm honestly telling you, follow a dedicated schedule for all 19 subjects in a time-bound manner. And I'm telling you, you are reaching to the highest of your potential. All right. Take care and may God bless you all. Thank you, Dr. Praveen.
Thanks, sir.